Okay, let's take a deeper dive into this, and for more on the challenges to the U.S. welfare system, we're joined by William Lee. He is the chief economist for the Milken Institute. William, good to see you. Thanks for coming in.
Thanks for having me, Sean.
Yeah, that story is really disturbing on a number of levels, the one that we just heard. U.S. unemployment is low, but welfare rolls are high. Firstly, what's behind this? And it's no secret that this giant gap between the haves and have-nots is just continuing to show more and more of a chasm.
That this is really one of the ugly sides of the United States, the bimodal distribution of income, where a lot of people who are in poverty, 12% of the population is making under poverty level incomes, and there really isn't an adequate social safety net to try to take care of these people. And people, I think, especially our viewers perhaps, have this misinformation about who these population are. They often think, oh, it's the Black, Latinos, recent immigrants, but there are a lot of Asian people who are in poverty, and I think we need to really address this across the board for everyone.
You know, SNAP benefits, commonly known as food stamps, they've been available for decades. A safety net to help people supplement the growing cost of food. Also, we heard about food banks that are out there in churches. Now, the higher allowance, the pandemic era, it's going away. Should this be extended to help these people that are really struggling to make ends meet and clearly worrying about where things are going?
Well, Sean, the pandemic really expanded the safety net so that the health benefits and other benefits flowed down to the people who are in poverty. Because before, the SNAP benefits were just one feature of the safety net, but they didn't get a lot of adequate health care, they didn't get a lot of adequate education and other things like that. Well, we really need to have a restructuring of the social safety net in the United States to provide services for people in need. And how to finance that is really the question. Right now, it's done on a state-by-state level because, frankly, the cost of living differs across every state. So it's right that states direct a lot of these safety net programs, but the federal government also has a role to try to provide overall funding and ensure quality is the same across the different states and different parts of the country.
And what we see so often is the governments simply don't want to address this. They just move on and they use tired terms like welfare millionaires. I defy you to show me a welfare millionaire in this day and time. And about 14 years ago, I lived on food stamps for a month for a story. And I had $67 for the whole month. Look, I don't know how people, they can either fill their stomachs or eat healthy for about 2 weeks. You can't do both. So clearly something needs to be done.
Well, Sean, there's without a doubt, every government program has got fraud and it's administered inefficiently. So there's no question there's fraud there. But even with a given level of fraud, because there's fraud in the Defense Department as well, the $1,000 hammers and toilet seats are just great examples of those. So yes, there's fraud all over government programs. And so maybe the best way to handle this is to restructure the program so that we give vouchers for people and direct cash benefits so that people can spend it on the things that they really need, with some supervision that they don't spend it on drugs and other such things.
Sure. And to pick up on that, the U.S. government spent close to $5 trillion, trillion with a T, dollars in the pandemic stimulus programs. Looking back, what should the U.S. government have done, perhaps a little bit differently, a different approach, if you will, to the welfare system and also to help out those during the pandemic?
Well, it's obvious that stimulus program indiscriminately handed out money so that has really fed the inflation problem that we have today. They should have first means tested everybody. How much money do you make? How much money do you have in savings? And that determines how much money you get. That wasn't done. But right now, we're talking about poverty. People who have not been able to make it out of the trenches at all. These people have to be identified, because a lot of people are just hiding away because they're afraid of immigration and other issues, and they need to be found and helped. The kind of help that's needed here is best done, I think, with a private-public partnership, so that where there is some accountability, there's some accountability that can be done at the very local, regional level. And I think these kind of restructurings are things that people have talked about since the days of Daniel Patrick Moynihan back in the 60s.
Yeah, right.
And so we honestly need this kind of reform, but there's no impetus on the political scene to do it.
I still remember that trip to Appalachia in the 60s, War on Poverty. I'm from West Virginia. That rings very true to me. Okay, so why is it taking longer for certain areas of the country? We just heard in William Denslow's excellent story about New York to see a boost from this pandemic-era welfare programs.
I think it's because a lot of it is fouled up in local government bureaucracies. Who's in charge of what, and a lot of political votes at the local level depend upon who administers these programs, because those administrators become the future politicians. So I think that's where some federal oversight and some federal level of intervention is needed to get it out of the hands of these kind of political things. But I think the criteria for different levels of benefits should be set on a geographic basis, depending on the local cost of living.
William Lee, always a pleasure. We certainly appreciate it. Well, I'm sure we're going to revisit this one. Thank you very much for your time.
Thanks for having me.